Hello, my name is Beth, and in this video I will be talking to you about my PhD, which is part of the NHS CHECK study. My PhD is looking at the mental health, occupational outcomes and well-being among lower paid NHS staff. And I am supervised by Professor Sir Simon Wesley, Dr Sharon Stevelink and Dr Danielle Lamb. Before I talk about my PhD, I just wanted to recap quickly on what NHS CHECK is. As you may know, it's the UK's largest study of the mental health and well-being of healthcare workers through COVID-19. It includes all staff, so not just clinical staff. It's longitudinal, which means we have assessed well-being and outcomes at different time points throughout the pandemic, starting in April 2020. The staff who take part in NHS CHECK come from 18 NHS trusts, and we have a total sample size of roughly 23,000 people. So what do we know so far? The first finding that emerged from the 4,378 participants who took part in the survey in the early months of the pandemic, so from April 2020 to June 2020, revealed that there were substantial levels of probable common mental health disorders, such as anxiety or depression, and also high rates of post-traumatic stress disorder, or PTSD. However, the NHS CHECK survey uses screening tools, and this is where I'd like to caveat some of that information. The screening tools are designed to identify potential mental health disorders. They are not designed to diagnose someone with a mental health disorder, so there is a caveat. The prevalence estimates of common mental health disorders and PTSD in healthcare workers were considerably lower when we assessed them using a diagnostic interview. A diagnostic interview is something that can be done in person or over the phone, and is normally done by a psychiatrist. When we used these, we found that 21.5% of healthcare workers met the threshold for a diagnosable mental health disorder. So whilst this still indicates that there's a substantial proportion of staff who may benefit from mental health support, it also suggests that caution should be used when interpreting the results from screening tools. So what happens when we look at the survey results over time? And this is where we have the first indications that lower paid staff may be at risk of worse outcomes. When we looked at the surveys from April 2020 to August 2021, we found that younger, female, lower paid staff, so those in band 5 or below, those who felt poorly supported by colleagues or managers, and those staff who experienced potentially morally injurious events were most at risk of negative mental health outcomes. We also found that all types of staff, so both clinical and non-clinical, reported symptoms. And I think this is important. The media may pay a lot of attention to clinical staff, but we cannot forget the non-clinical staff members who play a hugely important role within the NHS. And I hope my PhD will shine a light on this group, as non-clinical staff typically fall into the lower pay bands. The NHS CHECK study has produced many more findings, including qualitative work, which involves speaking to staff in interviews, providing important context for the surveys. We have looked at moral injury, suicide and much more. We have also produced a policy document outlining recommendations for how trusts can aid staff wellbeing, so please do check out our website. So moving on to my PhD, and what do I aim to do? So firstly, I hope to explore what is the impact of the COVID-19 pandemic on the mental health, occupational and wellbeing outcomes and associated determinants of lower paid NHS staff. Secondly, I'd like to look at how this impact has changed over the course of the COVID-19 pandemic. And finally, I aim to explore what existing support has been helpful in promoting positive outcomes and mitigating negative outcomes in these staff groups. So how will I do this? Firstly, I will analyse the data, comparing lower paid staff to other staff to see if they differ on certain outcomes, including mental health. The survey asks a whole range of questions about NHS staff's work life, their mental well-being, their experiences of COVID-19 and support. So there's lots for me to look at. Secondly, I will use all phases of the survey, including the latest one, which I'm going to talk about in just a minute, to explore whether this impact has changed over time. And finally, the third aim will be assessed using interview data. The NHS CHECK team has already carried out several interviews. They have interviews from 48 participants who completed the NHS CHECK 6-month follow-up survey, 12 members of staff who were involved in implementing the staff support programmes. I will use these to explore what support has been helpful, what individuals would like to see going forward, facilitators and barriers to access, and whether this differs for lower paid staff or whether they have unique needs. There is also the possibility that I might carry out some new interviews to see whether these needs have changed. We are very excited to announce that the NHS CHECK follow-up survey has launched, so please do check your inbox for your unique link to take part today. If you have misplaced your link, not to worry, please get in touch with the team and the contact details for this will be presented on the next slide. As the NHS workforce faces new challenges such as workforce retention and the cost of living crisis, it's really important for us to hear from you about what it's like now. And I hope to include some of these survey results in my PhD, so please do take part in the latest survey of NHS CHECK. Thank you for listening. If you're interested in hearing more about either my PhD or the NHS CHECK project in general, then please do get in touch.